This is the Sober Professor, and in today's class, we'll be discussing the World Health Organization's Alcohol Use Disorder Identification Test. This self-assessment has been used worldwide to screen for unhealthy alcohol use. If you find these videos helpful, give this video a thumbs up, hit that subscribe button, and click that bell to receive notifications. Now put on your thinking cap, make sure to take notes, and let this class begin. Welcome to Sober Life University, a digital university where we discuss all things sober. Today's topic, am I an alcoholic? Each person's body composition and alcohol tolerance level is different. So there are different levels of what would constitute as someone misusing alcohol and having what is called alcohol use disorder, or someone who is physically alcohol dependent and what most people know as alcoholism. The following set of questions are from the World Health Organization's Alcohol Use Disorder Identification Test, also known as the AUDIT, which is a method of screening for excessive drinking that has been used as a framework for intervention. The AUDIT is widely used by healthcare practitioners across the world. It is a series of 10 questions that assess alcohol consumption, drinking behaviors, and alcohol-related problems. Each question will be assigned a numeric score value, and at the end of the assessment, we will add your total score and provide the risk level for alcohol use disorder based on this assessment. For the purpose of this assessment, a standard drink is the equivalent of 1.5 ounces of hard liquor, or the approximate equivalent of 1 shot, 5 ounces of wine, or the approximate equivalent of a standard glass of wine, or 12 ounces of beer, or the approximate equivalent of 1 can of beer. As a legal disclaimer, this assessment is for educational purposes only and is not meant to be used as a medical diagnosis, professional assessment, or taken as professional medical advice. Always consult with your doctor or trained medical professional to determine any health concern and your recommended course of action based on your specific health conditions and needs. However, this may be a helpful guide to help you better understand whether your drinking habits may be something that you should discuss with your doctor. This assessment may help you look for symptoms of alcohol use disorder and may prompt you to take precautions and take action to prevent the development of alcohol dependence, otherwise known as alcoholism. Grab a calculator or a notepad to keep track of your response to each question and to add your total score at the end. Question 1. How often do you have a drink containing alcohol? If you've never had a drink, give yourself 0 points. If you drink once a month or less, give yourself 1 point. If you drink 2 to 4 times a month, give yourself 2 points. If you drink 2 to 3 times a week, give yourself 3 points. And if you drink 4 or more times a week, give yourself 4 points. Question 2. How many drinks containing alcohol do you have on a typical day when you are drinking? If you have 1 or 2, give yourself 0 points. If you have 3 or 4, give yourself 1 point. If you have 5 or 6, give yourself 2 points. If you have 7, 8, or 9 drinks, give yourself 3 points. And if you have 10 or more, give yourself 4 points. Question 3. How often do you have 6 or more drinks on one occasion? If never, give yourself 0 points. Less than monthly, 1 point. Monthly, 2 points. Weekly, 3 points. Daily or almost daily, 4 points. Question 4. How often during the last year have you found that you were not able to stop drinking once you had started? Never, 0 points. Less than monthly, 1 point. Monthly, 2 points. Weekly, 3 points. Daily or almost daily, 4 points. Question 5. How often during the last year have you failed to do what was normally expected from you because of drinking? Never, 0 points. Less than monthly, 1 point. Monthly, 2 points. Weekly, 3 points. Daily or almost daily, 4 points. Question 6. How often during the last year have you needed a drink in the morning to get yourself going after a heavy drinking session? Never, 0 points. Less than monthly, 1 point. Monthly, 2 points. Weekly, 3 points. Daily or almost daily, 4 points. Question 7. How often during the last year have you had a feeling of guilt or remorse after drinking? Never, 0 points. Less than monthly, 1 point. Monthly, 2 points. Weekly, 3 points. Daily or almost daily, 4 points. Question 8. How often during the last year have you been unable to remember what happened the night before because you had been drinking? Never, 0 points. Less than monthly, 1 point. Monthly, 2 points. Weekly, 3 points. Daily or almost daily, 4 points. Question 9. Have you or someone else been injured as a result of your drinking? If not, 0 points. Yes, but not in the last year, 2 points. Yes, during the last year, 4 points. Question 10. Has a relative, friend, doctor, or another health worker been concerned about your drinking or suggested you cut down? If no, 0 points. Yes, but not in the last year, 2 points. Yes, during the last year, 4 points. Now go ahead and add the total number of points from all questions. The audit categorizes scores into 4 different risk levels known as zones 1 through 4. If you score between 0 to 7, this is considered risk level zone 1 and refers to low risk drinking or abstinence, where the audit recommends providing patients with educational materials on alcohol substance abuse. If you score between 8 to 15, this is considered risk level zone 2 and consists of alcohol use in excess of the low risk guidelines. The audit recommends intervention using simple advice and patient education materials as the most appropriate course of action for these patients. If you scored between 16 to 19, this is considered risk level zone 3 and is considered harmful and hazardous drinking, where the audit recommends brief counseling and continued monitor by a healthcare professional. If you scored between 20 to 40, this is considered risk level zone 4 and referral to a specialist for diagnostic and evaluation, and possible treatment for alcohol dependence is recommended as intervention by the audit. If your score falls under the alcohol dependent category, it is highly suggested that you seek professional medical help to determine if you may need assisted detox by a trained medical professional or a treatment facility. Quitting alcohol cold turkey can be extremely dangerous and in some cases potentially lethal. Please seek professional medical help or call 911 immediately if you are experiencing a medical emergency. The audit recommends health practitioners to discuss the following with patients who exhibit the risk of alcohol use disorder, which your healthcare provider would tailor to your specific situation and health conditions. These would include discussing the patient's audit screening results, identifying risk and discussing consequences, providing medical advice, soliciting the patient's commitment, identifying a goal of either reduced drinking or abstinence, and giving advice and encouragement to reduce or stop drinking. Every individual body type and tolerance level is different, and there are additional factors that your medical health provider will consider in recommending your specific course of action. However, if you are in zones 1 to 3, finding ways to cut back or stop drinking will only provide positive health benefits that can help you from preventing alcohol use dependence, or what is more widely known as alcoholism. From my experience getting sober, what I found most helpful was finding a support group that encouraged me to pursue sobriety through in-person and online recovery programs. I was able to connect with others that shared their experiences on how they got sober, and they gave me the encouragement to quit drinking while building healthy coping mechanisms that changed my thinking and my relationship with alcohol. I share the 5 things that helped me to quit drinking for good in the video linked here. The key to cutting back or quitting altogether is to make a conscious decision to really want to make that change and committing to taking actionable steps to help you reach that goal. The benefits of cutting back or quitting altogether far outweigh the risk of developing alcohol dependence. And if you are fortunate to not have developed alcoholism, taking actionable steps to prevent you from reaching that level will only help you in the long run. If you have reached alcohol dependence or what is known as alcoholism, know that there are many resources out there and millions of people who have recovered that are willing to help you. I believe in you, and I hope that you believe in yourself too. This is just one of many different self-assessments that are available online. You can find a link to other commonly used resources in the description. Comment below and let me know what you found helpful or surprising from this assessment. I read through all the comments and do live streams across the social media pages. I encourage you to connect with others in the comments and support one another in your journeys. If you found this video helpful, make sure to give this video a thumbs up, hit that subscribe button, and click the bell to receive notifications. Thank you for enrolling in Sober Life University. Until next class, the Sober Professor, signing off.